Welcome to the Cannabis Review. I am delighted to be joined on this episode by Dr. Evan Lewis of the Neurology Centre in Toronto. Evan is a paediatric neurologist and a clinical neurophysiologist and has an expertise in epilepsy and epilepsy surgery and medical cannabis for the treatment of neurological disorders. So, Evan, how are you keeping?
I'm doing well. Thanks very much. Thanks for having me today.
Delighted to have you on the show, mate. You're a man with a wealth of knowledge in this topic, and it's great to be able to have a come back to the article that we had over here in Ireland about some information that may or may not be misleading. We'll leave it down to an expert like yourselves to give us the good information on it. So I'll kind of kick things. Actually, I might give the audience a little brief overview of how you got to where you are in Toronto and your expertise in the industry.
Yeah, sure. So, I'm originally from Toronto. I'm Canadian born and grew up in Toronto, but did my training in Ottawa in pediatric neurology and epilepsy, and completed my full training in Miami, a year there and a year in Toronto at the Hospital for Sick Children. And it was kind of following my training that was really when medical cannabis was coming up from the grassroots from a lot of the parent organizations. So this is kind of circa 2009 to 2012, 2013. And around that time, I had a bit of an interest, but there was a lot of stigma around it. And the vast majority of doctors and neurologists were not utilizing it at all. And that kind of piqued my interest, I guess. And after working for about a year and a half at the Hospital for Sick Children, I left and opened up my center, the Neurology Centre of Toronto, as a community neurology practice in Toronto. And there I was able to kind of be free a little bit of I guess, hospital oversight and administration, and could pursue some in my own interests. And that's when I really started to move into medical cannabis. And it was around that time that I just started collecting a lot of patients. They were coming to me, and I kind of, through my own experience, my own self-learning, and through my patients, who I owe a huge amount of thanks because they've taught me so much, really was able to move forward into the medical cannabis world, and started with pediatric epilepsy, which was my area that I'm trained in and had the most confidence, and felt that it was safe to pursue that with medical cannabis. And subsequently evolved that into other pediatric neurological disorders and adults as well. So that's culminated in kind of years of experience now, and through many patients, both adults and kids, as I mentioned, through epilepsy and non-epilepsy conditions. We've gained quite a lot of experience here in medical cannabis. We're just reviewing all of our patients now, and we're following over 500 patients right now for various neurological disorders. Oh, sorry, I think I lost you. You're on mute.
Hi there, I'm back again. So, perfectly positioned then to be able to assist us in this next topic that we're talking about. So, we were talking beforehand. You've read the article that was published in the Irish Times, where a number of doctors came out saying they weren't sure about the products that were being prescribed. From your point of view, and over in Canada, are there a safe list of products that are prescribed to patients over in Canada? And if so, are they available in Europe?
Yeah, that's really important because each country tends to have its own regulatory framework and its own product availability. So most products that I have access to in Canada are Canadian products. We have very few products coming from elsewhere, and that has to do a lot with regulation, but a lot to do with cost as well. But the products are similar in a sense that the ratios for THC, CBD are similar, and the corresponding additives, whether they be terpenes or other components, are also similar. So there is similarity between the products that are available in Canada versus the rest of the world. And but predominantly through our regulatory framework here, we can access those products quite readily that are Canadian. And really, there's no sense to kind of import products at this point and utilize them just because the costs are enormous. For instance, Epidiolex is one that often gets asked about in Canada. And GW Pharma has not moved into Canada as a market here. So to purchase Epidiolex is just exorbitant for families. It doesn't make any sense at all when we have analogous products such as purified CBD oils here available in Canada.
Okay, and do you see, in your opinion, the best medicines or the best version of cannabis for epilepsy? Is there a specific ratio of THC that seems to work best. Is pure CBD actually proven to have worked with epilepsy patients where there's no THC in it? So we obviously have a much more stricter rules over here when it comes to the THC content. So I'm just curious as to know, is there the perfect ratio of THC to CBD for an epilepsy medicine?
Yeah, this is a question that remains unanswered. So we need to know this, and we don't know this yet because we haven't done any real head-to-head trials on the different and varying ratios. So we have really good randomized control trials with purified CBD products, and those were the main ones that came out over the last decade. And those that gives us some direction from the purified CBD point of view, and some outcome data and some adverse effect data, and that's very high level evidence. So it's good to rely on that. But then we also have some studies that have come out that have been more open label related studies. They're not as high level in terms of evidence as we have available for the purified CBD products, but they certainly show some positive outcomes for CBD-rich extracts. Those are oils that have a higher amount of CBD in proportion to THC, but have a significant amount of THC in their products as well. And we have good outcome data there, and we have good safety data there too. Now, when it comes to that perfect ratio question, it's often a question I get asked a lot by patients, and it kind of doesn't really matter because if you have experience in cannabis medicine, you can design your own ratio. For example, I can give a purified CBD oil and give X number of milligrams of CBD, but then I could also supplement that with a purified THC oil and then give X number of milligrams of THC. I can make my own ratios. So I don't think there's a perfect ratio. I think that question is a big black box, and we still have we really don't have an understanding. And the truth is, I think that the resultant answer is going to come out of the certain epilepsy conditions. Depending on what is driving the epilepsy disorder, that is going to be what determines the ultimate proportion of CBD to THC or other cannabinoids. There isn't going to be a perfect proportionate amount of CBD THC to all epilepsy syndromes. I think that's a bit of a misunderstanding how epilepsy works, because epilepsy just means a tendency to have seizures, but there can be thousands of causes for that tendency. So we have to treat the tendency and not the actual seizures. And that's the medicine that will be that's coming in the future for medical cannabis, to really understand the proportion based on the disease entity that's causing the epilepsy, if that makes sense.
Yeah, no, completely. And I think that's one of the things that hinders the doctors over here is the ability to dose a patient perfectly. I think the future of medical cannabis is a patient being given an option of both, and their own individual ratio is going to be determined. But as you said, you're going to have standardized medicine based on the different ailment that you've got, or the age group, or the health group that you're sitting within. Do you ever see a scenario where somewhere like over in Ireland, we haven't legalized cannabis to grow yet? Is there an argument for, if we're going to create a grow industry, that we should be looking at what are the ailments that people suffer from in Ireland, and let's look at the strains that work best for these ailments? So if there is going to be a medical cannabis program, that there is strains and products that are made in Ireland, they're available for Irish patients.
Yeah, again, I think that's going to be difficult. Where do you stop there? I.e., which varieties of cannabis do you pick? And then when you pick those varieties of cannabis, which ailments do you pick? I mean, you can individualize this forever and ever. You can reduce this down to, so many different levels that's going to be a real complicated path to take. And I don't think I know the answer there. I don't know if anybody could reliably know the answer there. It sounds like a great idea, and that sounds like where things are headed. So I guess one way to look at that is ultimately probably what's going to be very important here is the individual genetics. I think the pharmacogenetics and the understanding of how genetics affect the endocannabinoid system, that and time is going to help us dictate the right treatment approaches for patients. And then in addition to the disease state, as I mentioned before. So it's the genetics and the actual disease, the genetics of the individual and the actual disease causing whatever ailment it is. I think the combination of that and really understanding that and how it interplays with the endocannabinoid system will ultimately allow us to tailor therapies accordingly, rather than going kind of the other approach from the other end. I think if we do that from the other end, you could do that forever, and I don't know if we would really come up with good answers there. But to to help with that right now, because we have to kind of work with what we have right now, it's important for a practitioner like myself, an experienced practitioner, to develop standardized protocols based on the best available evidence. And that's what we do at my center, and that's what I've developed here. So just as an example, for our epilepsy patients, we have a very standardized protocol that works through successive phases. And those phases, so all patients that come in with epilepsy from a certain cause start in a phase 1. We work them through the phase 1, and then if they fail, they go to phase 2. If they fail, they go to phase 3. And as we go through those phases, the treatment becomes more and more individualized to the person. And then that way, at least I know I'm standardizing myself, and then I can use those protocols to base further treatment decisions for my entire population, but also for the individual. So that's one way that a practitioner right now can try to approach these things. But when you start to do all these different kind of various different approaches, then you might not really know what you're doing, and that could lead to actually causing more harm than good.
Okay, so that kind of leads me on the last topic I want to talk about is future medicines. It seems to be, after our discussion now, that the perfect scenario is purified THC, purified CBD, and a ratio balance for each individual patient. Is that how you see the medical cannabis industry unfolding over the next number of years?
It might be. It's real hard to. It might be, and I'm not saying that's what I do here. Just to clarify, I do use the oils with certain proportions. So it's not so much about that proportion right now. For me, it's more about the actual dose, the actual milligram dose. Because if I know that can stay consistent from patient to patient. So for instance, coming back to the phased protocols we have, our phase 1 protocol targets reaching a dose of 300 milligrams of CBD. As an example, in most patients. So I'm just generalizing right now. So knowing, and that's based on the available evidence that has been produced. And there's some other slight changes there. If anybody wants to comment on this, I'm very happy to discuss in detail with people. But that's the first target. So it's more of a milligram dose, because that can stay consistent. Then I can read the literature and I can see what's being used from a milligram based dose, and not so much these proportions. To be very honest, when it comes down to how much THC is being included or whatnot, I do have standards for that, but sometimes I'm constrained by the cost. For instance, sorry about that there.
Okay.
For instance, the cost of high CBD rich extracts is really expensive and totally unaffordable for families. And we have no public coverage of our cannabis here. So sometimes I'm at a loss and I have to offer a patient a higher amount of THC proportionally to CBD, when I really want to target a higher CBD to THC proportion. So I'm a bit constrained by other factors. And I know that that's some of the difficulty that we see in other countries right now as well. So it tends to be that cost does kind of drive where things are at. So coming back to your question, I would love a scenario in which I could just design my own proportions and help patients in that sense, but it's not practical due to cost. It's not practical due to regulatory framework. So I'm stuck with having to use the proportions that are available and that are affordable for patients. So I try to manipulate the protocol for those patients accordingly.
Okay, interesting. Do you know of any products in Europe that you think are worth keeping an eye out for, or is Epidiolex seems to be the main one?
Well, again, I probably don't want to go into mentioning specific products. I think Epidiolex is the reason why Epidiolex, and I mentioned it, is so popular, is Epidiolex was the product that was used in the randomized control trials in the US that really resulted in approval by the FDA and approval in Europe. So it's kind of a little bit of that gold standard if you really go back and look at the trials that have been done. But subsequent to that, there are many trials in Israel, trials in Canada. There's work in Germany that's been done that has used CBD-rich extracts from various different companies with results that are as good as what we saw in the Epidiolex trial, or sometimes better, given that there was these are not the same degree of evidence and quality of control in those trials. But that's at least points to positive signal here that there are CBD-rich extracts from various different companies that contain THC that are effective in epilepsy. And from my personal experience with my patients, we see this. We definitely see this. And in some cases, THC is necessary. So we just actually published a paper from my center here in conjunction with the University of Montreal, my colleague, Dr. Will, where we showed a case series of patients who failed CBD, but then responded to THC and incremental doses of THC. We've got a great case study that shows complete resolution of seizures, maldevelopment neurologically, and EEG normalization with THC, not with CBD. So there is a role here for it. We have to understand it a little bit better. And I think anybody who has some understanding of the endocannabinoid system can understand where and how THC comes into play. And that was one of my big responses to the Irish Times article, was it just speaks to me that there's a lack of education about THC and an overall vilification of this substance, probably embedded deeply within our societies, our international society stigma against THC. And we have to really be a bit more open to this and realize where we're coming from and look at this more objectively, like true medical practitioners and true scientists should. And I'm happy to share the link to that article if you got corresponding notes to this podcast.
Yeah, we will indeed. We'll leave it down in the link for everybody. If you're watching the show, you'll see it down below. Evan, thank you very much for coming on the show. We've hit our time, but I could talk to you all day on this topic. Great. It's been an absolute pleasure to talk to you, and hope we get you on and we can talk again further on the topic in the future.
Would love to. I could talk forever on this as well.
Yeah, well, it's been an absolute pleasure, and I know the viewers would have gotten as much wealth and information out of that as I did. So thank you very much, and you have a great day.
You as well. Pleasure.
Until next time, guys.